With October's breast cancer awareness winding down, we thought that we'd pass along some words of wisdom. Dr. Dana Holwood is here with some useful tips on everything from breast MRIs to reducing your risk of breast cancer through diet and exercise. Welcome to the show.
Thank you for having me.
First person that comes to mind, Christina Applegate. She pretty much, was in the news talking about her genetic predisposition to breast cancer. We're hearing a lot more about it. Who's really at risk for this? Anybody, right?
Well, I mean, the number 1 and 2 risk factors for developing breast cancer in your lifetime are being a woman and getting older.
Okay.
When we look at the breakdown of what causes breast cancer, only about 5% of the cases are what we call genetic breast cancer syndromes. Okay. And that includes BRCA1 and 2, which Christina Applegate was diagnosed with.
Okay. And this affects men and women, though,
This
obviously,
affects
right?
men and women equally. And what we look at when we see patients, we look at their family history. We're looking for multiple people, multiple generations with breast cancer. A large proportion with maybe premenopausal breast cancer, so less than age 40 or less than age 50. And again, multiple family members, multiple generations. And it's not just breast cancer and ovarian cancer. For men, it includes things like prostate cancer, kidney cancer, colon cancer.
Right.
So we look for those patterns, and those are the types of families that we discuss the options of genetic testing.
When we're talking about testing, MRIs are a good way to go, but you say that there's some people that are perfect candidates and other people that may not be so, right?
Right. So MRI is a fabulous imaging modality, and it's really helped us in identifying early breast cancers. It is not appropriate for every single patient that we see. There are some very specific guidelines that we follow when we recommend MRIs.
For example, like who would not be?
Patients who have what we call a greater than 20% lifetime risk of developing breast cancer. And we determine that based on things like family history of breast cancer. So how many people, first-degree relatives, have breast cancer? Have they ever had a biopsy with abnormal cells, or what we call atypical cells? Those patients are appropriate for what we call screening MRIs. So we add that to their yearly screening. For women who have been diagnosed with breast cancer, we often use MRI to determine the extent of the disease. So is there more than one area of breast cancer within the breast? Is there a breast cancer in the other breast?
Right, and you mentioned that we should check because there's benefits and risks with having the MRIs done as well.
Absolutely. Like I said, MRI is a very fabulous imaging modality. It's very sensitive, so if there's an abnormality in the breast, the chances are the MRI is going to pick that up. But every abnormality that it picks up in the breast is not necessarily breast cancer.
Right.
So with MRI, you end up getting more tests and perhaps more biopsies, and those biopsies are not always going to show breast cancer. So it's not something that you want to use to screen for the population at large, because you'll be doing a lot of unnecessary procedures.
We've got about 30 seconds left, but you do mention that you can decrease your risk of breast cancer through diet and exercise. Do you have any tips for people out there that...
Well, I think that healthy living, not only improves your breast health, that it can improve your global health as well. So recommendations include things like low-fat diet and aerobic exercise. So you want to do exercise that actually gets your heart rate up and weight bearing, because it's also good for your bones.
Okay.
There are some studies that show that exercise can actually decrease the risk of developing breast cancer. And certainly for patients who have breast cancer, exercise can help them get through chemotherapy, through all of their treatment.
Right.
And my kind of tagline is, healthy living. Healthy living is going to benefit not only the breast, but your whole body.
All around,
Absolutely.
Exactly. Great information. We appreciate you being on.
This has been Better.tv. For more stories like the one you just saw, catch the weekday television program Better, your source for styles, trends, relationships, beauty, fitness, and other stories that will help make your day better. Check local TV listings to see if Better airs in your city. Thanks for watching.